Welcome to a video on preparing and maintaining phlebotomy equipment. This video is brought to you by Vadhwani Foundation. In this video, we will learn about preparing and maintaining equipment used by phlebotomists. Knowledge of equipment is the most important prerequisite to performing venipuncture. Let us start with the phlebotomy tray. The phlebotomy tray provides a convenient way to carry equipment to a patient's room or the collection rooms. The tray should be placed on a solid surface. Trays should be emptied and disinfected on a weekly basis. Venipuncture needles include multi-sample needles, hypodermic needles, a hollow needle with a syringe, and winged blood collection needles. Needles should never be recapped once the shield is removed, regardless of whether they have or have not been used. Needle stick injuries, which expose workers to blood-borne diseases, continue to be a significant hazard for employees. Needle pronto holders are attached to the needles used in the evacuated tube collection systems to avoid needle stick injuries. The entire needle holder assembly is discarded in a sharps container after use. To protect phlebotomists from accidental needle sticks, a means of safe disposal must be available whenever phlebotomy is performed. Place all needles and other sharp medical instruments in a sharps disposal container immediately after they have been used. Sharps disposal containers are blue in color or labeled with the biohazard symbol. Sharps container should be closable, puncture resistant, and leak proof on sides and bottom. Overfilling a sharps container increases the risk of accidental needle stick injury. When it is about 3/4 full, follow the lab guidelines to clear the container. The evacuated tube system (ETS) is the most frequently used method for performing venipuncture. Blood is collected directly into the evacuated tube, eliminating the need for transfer of specimens and minimizing the risk of biohazard exposure. The evacuated tube system consists of a double-pointed needle to puncture the stopper of the collection tube, a holder to hold the needle and blood collection tube, and color-coded evacuated tubes. Completely fill each tube so that the proportion of blood to chemical additive is correct. Otherwise, the test results may not be accurate. Tubes containing an anticoagulant must be gently inverted 3 to 8 times immediately after collection as per the specifications of the tube. Syringes are often preferred when drawing blood from patients with small or fragile veins. A phlebotomist is able to control the suction pressure on the vein by slowly withdrawing the syringe plunger. Blood drawn in a syringe needs to be immediately transferred to appropriate evacuated tubes to prevent the formation of clots. Winged blood collection set is used for performing venipuncture to draw blood from very small or very fragile veins, often seen in children and elderly patients. Plastic attachments to the needle that resemble butterfly wings are used for holding the needle during insertion. Tourniquets are used during venipuncture to locate patients' veins easily. The most frequently used tourniquets are flat latex or vinyl strips. The advantage of the buckle closure is that it stays on the patient's arm after release and can be retightened if necessary. Blood pressure cuffs can be used as tourniquets. They are used primarily for veins that are difficult to locate. Gloves are to be worn during all phlebotomies and changed between patient collections. Gloves are to be discarded in the appropriate container immediately after the phlebotomy procedure. Hands must be washed after removing gloves to prevent the transmission of blood-borne pathogens.